can really mess with your life for a large part of every month. Physical symptoms, as well as mood swings and difficulty focusing. It makes everyday tasks feel much harder, and people often misunderstand PMS because its symptoms are different for everybody. You might sometimes feel that you're being dismissed as being moody. It leads to a lack of support and a lack of understanding, and it can be really difficult and isolating for those who need help. I'm Brooke. I'm an obstetrics and gynecology doctor. Let's talk about PMS, what it is, how it can be diagnosed, and what treatment options are out there. PMS is the name given to the physical and emotional symptoms that can affect your life in the 2 weeks before you have your period. Now, these symptoms typically resolve once your period starts, and nearly all women have some premenstrual symptoms, but each person's experience is different. Most common symptoms include physical symptoms like headaches, fluid retention and feeling bloated, changes in your skin or your hair, having sore or tender breasts. Then there's the psychological symptoms like mood swings, feeling depressed, irritable or bad-tempered, feeling tired and having trouble sleeping, noticing changes in your appetite or experiencing food cravings, feeling clumsy. Now, symptoms tend to vary from month to month, but they can form a pattern over time. Between 2 to 4% of all women get PMS symptoms that are severe enough to prevent them from getting on with their daily lives. A very small number of these women get an even more intense form of PMS known as premenstrual dysphoric disorder, or PMDD, which can make it difficult to work, socialise and have healthy relationships. In some cases, it can even lead to suicidal thoughts. So here is a rundown of what premenstrual syndrome is and what can be done to help. The exact cause of PMS is not known. Throughout your cycle, your hormone levels change, mainly the progesterone and estrogen levels, and some women are much more sensitive to these hormonal changes, which can lead to the symptoms described. PMS has also been linked to changes in chemical substances in your blood called neurotransmitters, such as serotonin and gamma-aminobutyric acid, GABA. Now, in order to diagnose PMS, you should keep a symptom diary. Keep it for a minimum of 2 months and document every symptom that you experience and when. You can do this with many of the period tracker apps, or you can just use a paper chart, like one you can download on Google. Now, when you show your chart to your doctor, they're going to be looking to see which symptoms are the most common for you. And also they'd be looking to confirm if they happen just before your period during the luteal phase, which is the phase after ovulation until your period begins. And if there is indeed a cyclical pattern to your symptoms, it helps them to confirm which treatment option is best for you. For example, if you've got symptoms of depression and anxiety, but that's only for a week or 10 days before your period, it's more likely to be PMS. Whereas if you get it on lots of random days throughout the cycle, it may be that you suffer from depression or anxiety itself. If there's any uncertainty, then you might actually be given a course of medication called GnRH analogues for 3 months. If your symptoms improve, then this actually confirms the diagnosis of PMS. Now, what treatment is available? Firstly, the first line treatments are actually exercise, a healthy diet, and a reduction in stress. They've all been shown to be beneficial for the symptoms of PMS. For those psychological symptoms, CBT has been shown to be effective, and it involves discussing your symptoms with a therapist and then helping you learn new ways of managing some of those thought patterns and symptoms to reduce their impact on your everyday life. There are also complementary treatments, so supplements like calcium, vitamin D, Vitex agnus castus, which is a herb known as chasteberry, or ginkgo biloba may be helpful. Evening primrose oil is also suggested at reducing breast tenderness, but none of these supplements have very strong evidence bases behind them, but some of these ones that I've mentioned are actually in the guidelines. The next best option is to have hormonal treatments. So the mainstay of treatment is the combined contraceptive pill, particularly those that contain the hormone drospirenone. For example, one of the pills called Yasmin. These have been shown to be really helpful specifically for PMS symptoms. You can take it in a way to give you a regular bleed, like taking it for 3 weeks of the month and then having a break. But actually, for PMS specifically, it may be better to take the combined pill continuously, so not having any break, in order to reduce the fluctuation in those hormones. You might find that you experience breakthrough bleeding if you're taking these pills back to back, so your doctor might suggest that you have a break every 3 months or continuously take it and have a break when you experience breakthrough bleeding. Another option is to try non-hormonal medications like antidepressant medications such as SSRIs like sertraline, and they can be helpful, but they also have side effects that you should be aware of. Now, if these options don't work, your doctor can adjust the doses of those medications, or they may suggest the next step, which can be a GnRH analogue. They cause a temporary but reversible menopause. They literally switch off your ovaries, so you don't release any eggs during that time and you don't have any periods. Finally, in extreme cases where those symptoms don't improve, then sometimes the removal of the uterus along with the ovaries and fallopian tubes can be the only option for severe intractable PMS, obviously in somebody who has completed their family. So that means that they have a total hysterectomy with bilateral salpingoophorectomy. Now obviously we don't jump to a surgical management for these PMS symptoms very early on, but it's good to know that there is a range of options out there. Above all, if you're struggling with symptoms of PMS, you should not just struggle in silence. Speak to your doctor and ask them about the treatments that might be right for you. If you have found anything that's particularly helpful for your PMS symptoms, please let me know below.